Now, a consortium of researchers have used genetic modification to reduce mosquito populations in a controlled setting. This gene editing tool aims to reduce at least 90% malaria mortality and eliminate malaria in 28 districts by 2028. My colleague Sarah Pencroft delves into the multifaceted challenges of Ghana's fight against mosquito-borne diseases.
From the notorious Anopheles mosquitoes, which transmit malaria, to the Aedes mosquitoes, which carry diseases such as dengue fever and Zika virus, Ghana is home to a diverse range of these tiny yet formidable creatures, which has heightened concerns over public health. Malaria remains a top priority in Ghana's fight against mosquito-borne diseases, as climate, urbanization and socio-economic factors contribute to the ideal breeding conditions for mosquitoes. Despite progress made by the country in the provision of mosquito nets to vulnerable populations, the use of advanced diagnostic tools, the availability of malaria vaccine for children, and mosquito control initiatives, reducing the disease transmission rate remains a challenge.
Within the cage, we do have males and females.
Principal investigator for target malaria in Ghana and senior lecturer at the Department of Animal Biology and Conservation Science at the University of Ghana, Dr. Fred Abuaji Entry is among a consortium of researchers who are currently working to develop a new tool to improve management of the disease.
We here in the University of Ghana are working with a consortium to kind of understand the role that mosquitoes play within the ecosystem, such that if you remove them from the ecosystem, what will happen to the ecosystem? So what we are doing is to try and have a fair idea of the impact of such a technology on the ecosystem, on human health, on animal health, and on water quality.
He said the malaria elimination target can be feasible if there is proper coordination between stakeholders in the implementation of innovative solutions.
There has been countries where the disease is borne by some of these mosquitoes have been eliminated, which means that it is doable here as well. Funding for research is very limited, and most of the funding that we get for research comes from the West. And so if we don't get that support, then it becomes difficult for us to research into the very diseases that affect we as a people.
Program Manager of the National Malaria Elimination Program, Dr. Kezia Malm, is certain the new tool, when developed, will improve progress made.
I know there's a lot of research going on, not just in Ghana, but across the world, on making mosquitoes sterile so that the population of malaria mosquitoes are reduced, and then even when they mate, they don't produce more. So some innovations, but we are yet to see them come upscale.
Ghana stands resolute and determined to reduce the burden of mosquito-borne diseases, using World Mosquito Day to create more awareness about the parasite. Sarah Pencroft, TV3 News, Accra.